Respected Chairperson, learned audience from home and abroad, I am Dr. Sabina Karim, working as Associate Professor, Pediatric Hematology and Oncology at National Institute of Cancer Research and Hospital. And my topic is Profile of Pediatric Oncology Patients Treated by External Beam Radiotherapy, Experience from NICRH. So, pediatric radiation oncology is very essential and important for multidisciplinary management of pediatric solid tumors especially, and this is the first case of bilateral retinoblastoma treated in 1957. He lost his right eye, left eye was uh, vision was returned to normal with linear accelerator radiotherapy. Unfortunately, most of the low and middle income country, you see here in orange that have no radiation facilities, and most of the high income countries shows it green, have all the centers have radiation oncology coverage. And very unfortunate situation is African countries, that in most of the countries no radiotherapy machine at all. So this is our hospital's profile. It started in 1982, upgraded to 500 bed 300 bed hospital in 2015, and total 500 patients average per day getting radiotherapy from our institute, and 5 to 10 patients per month in pediatric radiation oncology. So radiation facilities in our institute is on the left side. However, we have no dedicated pediatric radiation oncologist, therapeutic radiographers, and other special facilities for treating children. So pediatric malignancy is less and rare compared to adult malignancies, but when we compare in terms of life years we save, and it is the fourth most common malignancy, and biology of childhood cancer is significantly different from adult cancer, so it should be treated under pediatric oncologist. And childhood malignancy is highly curable if treated appropriately under appropriate physician. So cancer is also the main cause of death in children, as communicable disease is now under control due to EPI and other vaccination processes, and majority of pediatric tumors are radiosensitive, but radiotherapy in children should be undertaken in specialized pediatric radiotherapy centers. And childhood cancer is rare, and it is a challenge for adult radiation oncologists because they encounter children very often or occasionally, and also you need to have basic concepts and insights about the disease biology and disease process and multidisciplinary risk adapted management before treating the child. And RT is not the sole modality of treatment, and there are so many planning techniques evolving day by day, so it is really tough for the adult oncologist to treat pediatric patients. So there is shortage of dedicated pediatric radiation oncologists in our country, and our previous speaker showed that needs anesthesia facilities and dedicated anesthesia facilities. Also play therapist is needed. So more time is needed for pediatric patients consultation, preparation, and timing, and all of the team members should have continued communication to solve the pediatric issues. And it is essential for improving the highly curable pediatric malignancies like nephroblastoma, medulloblastoma, retinoblastoma, and other embryonal tumors. And WHO has taken an initiative to increase the cure rate of pediatric malignancies from in low and middle income country 30% to 60% in 2000 by 2030 to deliver the best care for children and excellent care for children which needs radiotherapy facilities in. And these are the 6 index cancer which WHO has taken for to increase the cure rate. And children get radiotherapy actually from head to toe. It depends on the disease category and types of radiotherapy we all know. And we always should keep in mind when treating a child, the child is not a mini adult. So drug error is most common in children. Managing neutropenia and other issues is very important, and children are in continuous process of development, physical development, cognitive development. So principle of radiotherapy is to target the tumor and sparing the normal tissue and surrounding as much as possible to decrease the long-term side effects of radiation. This is the mode of radiotherapy planning. We see that we go higher technique, normal tissue sparing is more. So what are the organ at risk to spare the long-term side effect? Actually, except the tumor, all are organ at risk. So these are the long-term side effect: hormonal issues, neurocognitive deficiency, growth issues, second malignancy, fertility. These are the key areas which we should discuss. It is not needed in adult all the time. And we sometimes use concurrent chemoradiotherapy in the diseases like rhabdomyosarcoma, medulloblastoma, and these are the radiosensitizing drugs which we use. And ideal pediatric radiotherapy facilities should have the following specialists, and child should be treated in age and developmentally appropriate ways, and we included 247 patients up to 18 years in 4-year study. It is a retrospective study done in the Department of Radiation Oncology, and these are our results. And this is the age group, and main age group is 11 to 18 years, and these are the CNS tumor we got in our study. These are the bone and soft tissue sarcoma profile. This is the carcinoma group, where nasopharyngeal carcinoma and carcinoma rectum is noteworthy. And this is the leukemia lymphoma group. Most are palliative except Hodgkin lymphoma, and embryonal tumor is 27. So another study, what is happening in our neighboring country, it is a study from Pakistan. They got 496 patients in a 10-year study, and this is their profile on the right side. And this is a study from Nepal, where they in India, and they analyzed 73 patients, and their profile is different from us. So what is challenge? Challenge is pediatric cancer is rare, each child is unique, and it involves complex input from very different professionals. This is another study from Nepal. They treated 73 patients. This is their profile. And what is needed? It is essential to make pediatric radiation oncologists adult oncologists should come forward and take training in pediatric radiation oncology to make it curable. And dedicated pediatric radiation oncology is essential component of high quality childhood cancer services, and can limit the normal tissue sparing, that is long term side effect can be avoided. And by 2035, 7 million projected cancer cases will occur in the low and middle income country. So treating children will be a growing demand. So International Society of Pediatric Oncology formed a group, Pediatric Radiation Oncology Society, in 2006 with American and European Society of Pediatric Radiation Oncology, and they have major outreach radiation oncology programs also. So I acknowledge our colleague and Madam Professor Asma Siddiqa, Dr. Nizamul Haq, and Dr. Johirul Islam, who helped me in preparing this study. So no child should die at the dawn of life, and childhood cancer is curable. Thank you all for your patient hearing.